teacher and classmates. My group will talk about the art therapy. I'm Masia. The first term is art therapy. Well, what is art therapy? Right now, I practice the art therapy. This shirt was made with art therapy, and my makeup was made with art therapy. Indefinitely, we can all practice art therapy. The art therapy is a form of therapy which the patient or people use different visual art as a way to help improve mental helping and emotional comfort. This therapy can be under the authorization of a specialist or be practiced by yourself. However, it's must to oriented about the patient express her personality or creativity using different art techniques. The art therapy is relative recent professional field. Although it began to use initially of the purely therapy proposed, with in the end of the World War II. With the soldier, we can different mental and psychological problems. This therapy emerged in Europe and USA at the end of the 19th century, thanks the new approbation of the physiological and ethical thinking of the time. The change in the 19th or 20th century made the people be understand in different way terms about the education, health, social relation, and art.
Types of art therapy. The dance is defined as the psychotherapeutic that use movement to allow an integration the emotions with the physical body. And this can express it of a verbal communication, produce changes in feelings, cognition, physical function, and behaviors. Drawing. Drawing and painting consist in the use of plastic art as the therapeutic way to heal physiological disorders like treat fears, personal blocks, past trauma, and others. When we drawing and painting, hiding feelings convert in textures, lines, colors, or shapes that are exploring us through the art. Music. By playing an instrument or singing, you create your own melody that tones out your desires or emotions that are not expressed verbally. This discloses of a sense of security, strategies to manage stress, creative expression, communication, and social support. The theater is a space that we absolutely free to develop our creativity without competing, stereotype-based judgment, and denotate the conscientious and self-knowledge of inner research elimination fears when performing theatric improvisation. The real stories are manifested from the unconscious. Play. The play is the part of the art therapy that are varieties of activity that transform problems of the current life in the way to solve them and learn about themselves and their relationship with the world. Throughout the game, you are given strategies to cope with difficulties that are making powerful changes.
Art therapy can be used to treat a wide range of medical disorders and psychological disorders. Some conditions for which art therapy can be used include
problems related to aging, anxiety, depression, emotional difficulty, stress, and cancer.
Art therapy uses a variety of art methods to improve people's quality of life.
The benefits of art therapy. It allows the person to express their feelings, thoughts, and emotions. Therefore, it acts as a way of liberation. It is an effective way to help those people who have difficulty expressing themselves and communicating, promotes emotional self-awareness and regulation of behavior. It is useful in areas such as rehabilitation, education, and mental health. Help to improve the quality life. It is very effective with people who suffer from sensory, physical, and or social adaptation problems. It is useful for with people with Down syndrome and Alzheimer's. It works with children and teenagers who suffer from learning disabilities. It can be used to treat phobias, helps improve symptoms of attention deficit hyperactivity disorders. It is very effective in eating disorders. It is used effectively to treat addiction, strengthens self-esteem, and help patients suffering from depression. It has been shown to be effective in helping terminally ill patients. In general, art therapy makes it possible to give meaning to highlight a stimulation task that is also very creative. At the same time, it offers a way to express feelings and point of view that otherwise would be reserved for the person, sometimes generating frustration. Thank you.
The word massage has a different definitions depending of the author approach. Some speak of such a tactile language established through the skin and that at the same time can be interpreted as the action of repairing the human body through movement, as I mentioned in violence. While in the field of physical therapy, the physiotherapist Marta Vélez points out it as the set of manipulation of the soft tissues on an area or in the entire organism with the aim of causing therapeutic modification. It should be noted that massages as such can be performed with any type of person, and for this reason, unwanted effect may occur. Due to this, it is recommended that a professional in the field apply the massage since they will have the knowledge due to the anatophysiopathological behavior of the human body before certain manipulation, as well as the constant search for the well-being of the patient from the biopsychosocial point of view as the main objective of this therapy. A therapeutic massage technique. Grouping it is with animation section begins and ends.
History of massage therapy. The earliest writing record of massage therapy were discovered in Egypt and China. Tomb paintings in Egypt depict individuals being naked by others. Furthermore, Egyptians are credited with creating reflexology in approximately 2500 BCE. In China, texts documenting the medical benefits of massage therapy date back to approximately 2700 BCE. The Chinese tradition of massage therapy was developed from the combined expertise and methods of doctors in traditional Chinese medicine. The history of massage therapy dates back to 3000 BCE in early in India. where it was considered a sacred system of natural healing. In Greece, between 800 and 700 BCE, athletes used massage to condition their bodies before competitions. Type of massage: Swedish massage, hot stone massage, aromatherapy massage, deep tissue massage, sports massage, trigger point massage, reflexology, shiatsu massage, Thai massage, and prenatal massage.
Benefits. One of the immediate benefits of massage is a feeling of deep relaxation and calm. This occurs because of massage prompts the release of endorphins, the brain chemicals, and neurotransmitters that produce feelings of well-being. Some of the physical benefits of massage and myotherapy include reduced muscle tension, improved circulation, stimulation of the lymphatic system, and reduction the stress of hormones. Now, most of the common side effects. While complaints of minor reactions to treatment are normal, some more serious or repellent can occur. First, we have the lingering pain. Due to the prescribed techniques used in a deep tissue massage, muscle chest, muscles return feel relaxed, potentially cause or muscle aches. A heart attach. A possible reason for your head pain may be due to the odd position of your head during the massage. Inflammation can be a result of the constant stimulation during the treatment. Redness or heat. Seeing signs of redness, feeling heat is highly uncommon and typically isn't serious.
Indications. There are three main types of contraindications. The first one is the total one, which happens when the therapist can give a massage at all to the client because this client or patient has a contagious disease or a skin disease or has been operated recently. The other type is the local contraindication that happens when the massage therapist can give the massage but not in all parts of the body or in parts affected by varicose veins, joint problems, broken bones, muscle injuries, and others. The third type of contraindication is the medical one. This one is presented when the massage has to have a medical approval. Some of the conditions that affect the massage are: if the client has osteoporosis or high blood pressure or thrombosis, cancer, diabetes, etc. Massage therapists. Massage therapists are professionals qualified to give people massages. These therapists must have certain understanding of human anatomy and physiology. By using medical history and examinations, the therapist will determine whether or not the client or patient is qualified to receive a massage. Currently, the professionals who perform massages in the different modalities are the physiotherapists, doctors, and chiropractors, and others. An important fact is that any body manipulation that involves a high risk must be observed or supervised by a doctor. Thank you very much.